Buongiorno, ladies and gents. This is Doctor Conor, and today I will be performing heart surgery. But first, I'm at my main desk and I have to sort a few things out before I go into surgery. And I'm not entirely sure what I'm supposed to be doing, so let's just try clicking the mouse. Okay, that mouse is broken again. Gonna have to call maintenance, tech support. Surgery, okay. Now here's Bob. This gentleman requires heart surgery, so I'm going to have to go in and transplant his heart. Which means, more or less in layman's terms, taking the heart out and replacing it with a new heart. A heart that's actually working properly. So, let's just get this sheet out of the way. If my hands will work. I have to admit that whenever I injected this guy with morphine, I sort of took some myself, so I'm not feeling the best. Right, Bob? Now what we're going to have to do here, Bob, even though you're sleeping, and my watch came up for no reason, but yeah, Bob's sleeping. I just don't want to get my watch lost inside his colon or something. That's the biggest cliche ever. So let's just put the watch over here by the radio, by the alarm clock. And how are we going to begin? Because we have to get these ribs out of the way first. As you can see, they're in the road and so are his lungs. So what is the best possible way for getting the ribs out of the way, you ask? Let's see. Probably a bone saw. Okay, just moving it over closer to him so I can better maneuver myself. Now, Bob, you won't feel a thing. I'm pretty sure of it. Okay, this is crap. I don't want that. Let's try this thing. Let's try the saw. The motorized saw. Okay, maybe not. Let's try and inject him with something green. Maybe he'll turn into the Hulk. Who knows? Right, Bob. There we go. You're injected with something green. What's the blue thing? There's a blue purpley thing here. Let's inject him with this. But I think this is to freeze his organs so that he can't take damage. Where did it go? Oh well. If he feels pain, he won't mind. He's sleeping. Let's try the hammer. Out of the way. Hammer. It's time for you. Some might say it's hammer time, but not me. So let's get these ribs out of the way. So far I'm doing a good job, I have to say. All those years in surgery college and university have paid off. A lot of you don't know this, but I'm the best surgeon in the world. Some might even say the universe. So as you can see, I've cleared the rib cage that was in the way, and it's not entirely necessary in this day and age anyway. Very few people are under threat of damage to their midriff or their mid-body. So just going to take the lung out, and I'm going to set it in this little thing. Also going to take his other lung out, because, you know, what's the point in having one if you don't have another? I'm going to put it down here. And there's the heart. So let's see if I can get the heart. Oh, first I want to get rid of these rib fragments. With our technology today, we can give them metal ribs. Alright, and let's get that heart out. It doesn't seem to want to come out. Maybe those tube things, arteries, whatever they're called, tubes, are in the way. So let's just get that lung out of the way. We can give him a bag that will inflate in place of a lung. Let's get a scalpel and see if we can't get those out of the way, shall we, Bob? There we go. That's one tube out of the way. Let's just set that back down because I'll be coming back to that later. Oh, didn't mean to feel your face, Bob. Just on my way down here to take your heart out. You shouldn't feel a thing. This isn't going well. I can't seem to get a grasp of his heart so I can pull it out. Oh, here we go. Here we go. Maybe if I go down this way. Right. What's in here? Oh, that's his heart. Can we get him 2 hearts like Doctor Who? I wonder if I'll be the first creator of the Time Lord. Job done. Now all we need to do is get that other heart out because it's not entirely necessary. What should I use? Let's go back to the scalpel. Seems quite useful in removing these tube things. Whoa. Sorry, Bob. You seem to be bleeding internally. That wasn't my fault. Your heart seems to have exploded for some reason. I just need to get the other heart in place. So, okay, we got the heart, Bob. Now all we need to do is lodge it in there. It will outgrow and overwhelm the other heart in days to come. So, successful operation, Bob. You did very good. Good boy. Join me next time for more Surgeon Simulator 2013. Bye bye.